Hi, I'm Kristen Goodwin. On this episode of the Fox News Rundown, despite days of negotiations on Capitol Hill, members of Congress remain divided on a coronavirus relief deal. West Virginia's Democratic Senator Joe Manchin says he thinks lawmakers on both sides of the aisle should be doing more to help the American people. The senator shares his insights on the ongoing debate over COVID-19 stimulus legislation, the 2020 election, and why he says he's not a Washington Democrat like many others in his party. And the pandemic is affecting virtually every part of the economy, but with social distancing mandates and nervous passengers, the aviation industry has been hit particularly hard. Former Spirit Airlines CEO Ben Beldonza joins the rundown to discuss the economic impact of the virus and what commercial airlines are doing to keep customers safe. Plus commentary from full-time practicing physician and Fox News contributor Dr. Nicole Saphier. The Fox News Rundown is a daily news podcast where we take a deeper look at the stories important to you. You can subscribe on your favorite podcast player by going to foxnewspodcast.com.
I'm Greg Jarrett.
I'm Shannon Bream.
I'm Steve Ducey, and this is the Fox News Rundown.
Wednesday, August 5th, 2020. I'm Jessica Rosenthal. As individual states navigate their way through the pandemic, one moderate Democrat says he's focused less on politics and more on getting his rural state internet connections for remote learning and enough cash to weather the job losses.
You know, Trump is very popular in my state, and I've done everything I can to work with him. I want my president, no matter who he or she may be, I want my president to succeed. I've always said that.
I'm Dave Anthony. It's still a tough time for airlines, as many people avoid travel fearing they could get sick from just flying somewhere.
While you're on that plane for 4 to 6 hours, you're probably safer in terms of getting virus transmission than almost anything else you would do other than just maybe staying at home.
And I'm Dr. Nicole Saphier. I've got the final word on the Fox News Rundown.
This week, the president said in a sit-down interview that the U.S. is doing well in our fight against the virus, that it's as under control as it can be, and that much of what needed to be done has been done by states' governors, whom he says were given massive amounts of materials to do their jobs by his administration. But he also argued the U.S. is doing well when it comes to the number of those who've died, despite our high death rate. He insisted on comparing the number of deaths to the number of those who've tested positive for the virus, rather than the country's population as a whole. Tuesday, he was asked at the White House briefing why he insists our mortality rate is so low when, per Johns Hopkins, we have the most deaths compared to our population after the UK, Chile, and Peru.
New York had a very tough time, as you know, New York, New Jersey, that area. And when you take them out, just as an example, take a look at Florida relative to New York. That's not to say anything wrong with New York. It was just a very tough place. People are close together. It's crowded. It's not easy. But when you take that out, our numbers are among the lowest. And even with it in, I will get back to you, but we have among the lowest numbers.
Meanwhile, federal unemployment benefits have expired, and Democratic leadership is still fighting with the White House over future virus relief funding. And the president now says he's okay with mail-in voting, but only in Florida. We talked about all of this, the virus, the election, mail-in ballots, with one of the most moderate Democrats in Congress.
My label, as people would know, would be I'm fiscally responsible and socially compassionate. And I think most Americans, whether you're Democrat or Republican, have fallen into that category.
Joe Manchin is a U.S. Senator for West Virginia.
And there's just not much of that in the political arena today. It's almost a tribal mentality to where you have to fervently support your tribe, no matter right, wrong, or indifferent, no matter how radical it might be. And I just won't do that. I always said if I can't come home to a wonderful West Virginia and explain it, I can't vote for it. It doesn't matter whether it's Democrat or Republican issue, for or against, whatever. If it doesn't make any sense whatsoever, I'm not going to support it. And I'm always going to try to be helpful to the other side. So my Republican friends and colleagues, I don't go out and campaign against them. I'm not responsible who they send to Washington to represent them from any state in the union. My commitment is to work with anybody that's sent here to make it better for all of us, for the entire country and state by state.
Let me ask you about the virus. There's been this accusation that there's no national coronavirus plan. My understanding is that most health-related issues fall under states' jurisdictions. Of course, there are national apparatuses. Of course, we've got HHS and CDC, but that many decisions are made more at a more local level. What sort of national plan is this administration supposed to have that would work for the entire country?
Let's go. I'll go back to my childhood, and you're talking in the 50s now, okay? Polio. All my vaccinations were given to me in school by the health department. Can you believe that?
No.
Yeah, I mean, it was very functional, very, very effective. Now, that wasn't local from the standpoint other than the local people who were administering it, but it was a national movement as far as polio vaccination and all different types of things that we were protected by growing up. And it was just a different time. And to say now that we don't have a responsibility, National Institute of Health, CDC, all of them, basically we should stay ahead of all this. We should have, there should be a cadre, and there always has been a cadre of scientists that were scoping and scouring the world, finding out where we could be vulnerable. I never could figure out why the president didn't immediately, no matter what the sins of the past has been, and whoever wants to blame whoever, previous administrations or this administration, once we have it and we know what's coming at us, then you should use the Defense Production Act, basically Production Act, Defense Production Act, to put every force you have in movement, in motion, so that people don't be held vulnerable. So we should have testing available, PPEs, and it shouldn't be profiteering either. Anyone who has the ability to manufacture what's needed to protect American citizens must be called to arms to do it. Well, and I believe that was a great thing that we missed.
What is going on with the coronavirus relief, future relief bill? It seems like things are still kind of far apart, but there's movement. Leadership is talking. Is it just over the amount? It sounds like the White House is, Treasury Secretary Mnuchin is stuck on this $1 trillion number. Democrats want more. Is that what it comes down to, just the amount?
Well, I think if you look at the Democrats right now from the House side, they said we've passed a bill. So we've done our job, and it's a very large $3 trillion bill. I personally don't support that amount that they're putting towards different areas. Not saying that we don't have a need, but you can't cure all of the social needs within a pandemic bill or a health crisis bill. First of all, you should take care of the health crisis. And I've said this, it's not one hospital, definitely not one rural hospital should ever close during a pandemic. There shouldn't be one healthcare provider that's not able to be in business to take care of people in need. So let's put the money where it's needed. This is a healthcare crisis. What are we doing? Are we doing enough to protect people? Are we doing enough to test people? You're asking people to go back into a normal life or go back to work, go back to school. Well, we know that children can carry, be asymptomatic and carry it. So now we're asking teachers who might have vulnerable parents at home or vulnerable members of their family, they're going to be concerned. They want to make sure that they're protected. They want to make sure that these kids coming to school are basically not infected. I understand all that. And on top of that, you want to add insult to injury. They're saying, well, we're going to allow distant learning. That's wonderful. If you live in the hollows and the mountains of West Virginia, don't you have to have connectivity? Don't you have to have high-speed broadband connectivity? How in the heck do you believe these people can function in a COVID crisis for the next 5 or 6 months until we get a vaccine and have no internet? Tell me that. Tell me how a patient, an elderly patient who can't leave their home, should not leave their home, is going to get telehealth when they have no connectivity.
Are you working on that?
Yes, we are.
Are you trying to get people internet?
I have a bill on that. It's called basically, and I've spoke to Mnuchin. I think we're going to get it, and he was very receptive. I said, Steve, how in the world do you expect us to navigate in rural America, rural Appalachia, when people have no connectivity that you're determined that they should have in order to have the services they need? He says, fine. I says, we need hotspots. If nothing else, I said, at least we can have hotspots available to citizens that live in remote areas to go to their library and take it like you would check out a book, and be able to have some connectivity. My constructive criticism of Mitch McConnell. Mitch, we've had 2 to 3 months. You've never put a working group together, a bipartisan working group. We've asked for this. So we have to do it in the back of the halls and talk to each other. What's going on? Do you agree with this? Do you agree with that? What can you live with?
Manchin says he was all for making people whole who lost their jobs or businesses, but that $600 additional a week for some West Virginians was more than they had been making, and so they weren't super excited to go back to work.
Okay, here's the employer says, okay, now we're starting to reopen, and I can't get people to come back to work. Well, if the employer by right would say, I'm going to turn you in to unemployment compensation office in my state or my locality or my area that you've been offered a full-time job to come back to and you won't come back to it, you'll lose your unemployment benefits. But they didn't want to do that. They didn't want to cause all the problems and hard feelings that would come. They said, well, I just have to live with it to July 31st. Now the bill comes along expanding that to the end of the year. And they're saying we can't live with that. So what do? There's got to be a pathway forward. That's all. And you got to sit down and be reasonable about this.
It sounds like you're asking for some nuance. Let me ask you before I let you go about the election, because there seems to be a debate over debates. Some in the media are calling for no debates, saying they serve no purpose. In the president's case, they're saying, one of the articles says it just allows him to put on this show. But is it really about that, or is there a concern that a debate performance could make the former Vice President Joe Biden look bad or weak or not as sharp as President Trump?
No, I don't think that at all. I've known Joe Biden for quite some time. Joe Biden just a good quality human being. He's got a heart and a soul. Truly has a heart and a soul. He's been through some difficult times and some challenges and a lot of things thrown at him and all that, but I can tell you when it comes time, he's always been there. He always wants to help. He always wants to be involved. He's just been very compassionate. I've always found that. Mm-hmm. And I think right now that country needs a heart and soul. It needs someone who understands the pain that people go through.
So it sounds like you're saying we should have the debates.
I think the people deserve to see both of them side by side and make their decision, even though people seem to be already made it. So, Trump is very, very popular in my state and very much supported. I've done everything I can to work with him. I want my president, no matter who he or she may be, I want my president to succeed. I've always said that. And whoever that president is, I will always work to help them succeed. I truly will. But I just believe that the change is needed right now for the sake of our country.
Finally, Senator, you are involved in the mail-in ballot issue. I know President Trump has said that he might even sign an executive order. We don't have any details on that yet, but he expressed some frustration with Nevada's new bill that's going to give every registered voter a mail-in ballot. He tweeted that it's like stealing the election, and furthermore that the post office won't be able to really handle this influx of ballots. The post office has said it believes, the Postmaster General said they believe they can handle, everything. But we also understand there may be some service cuts and closures. You're involved in this. You're concerned about this.
Oh, my goodness. The first thing they did, a week or two ago, I think at least a week ago, we had post offices in West Virginia posting notices they'd be closed. They were closing. I said, well, where's this coming from? Wrote a letter immediately, and they retracted that and said they're going to review process this and that. It's awful. This person, Mr. DeJoy, is just absolutely, I think, committed to closing post offices and making them private. So I have a bill called the Post Act. Okay, it's Protect Our Services Today. It's very, for the sake of democracy, and the sake of for many, many millions of Americans. That's the lifeline they have. Their medicine comes through the postal services. These are people that live in rural areas that don't have internet connectivity. So the post office is their lifeline. And it has always been our connectivity to the freedoms that we enjoy and the democracy that we have. And I just cannot believe that a person is not committed to making this work. We can't even get a phone call returned from DeJoy. And this person put in this purely political partisanship. He put him in a position that the man has been flagrantly opposed to the Postal Service.
And so your bill would just stop what? It would just
at least during the pandemic, you cannot close any post offices during the pandemic. It's pretty simple. You cannot do it.
Senator Manchin, thank you so much for your time.
Thank you for having me. I enjoyed it very much.
This is Dr. Nicole Saphier with your Fox News commentary coming up.
Are you ready to travel in this corona crisis? American, Delta, and United are all adding more international flights at a time when more people are traveling. On Sunday, the TSA reported the number of passengers who went through airport checkpoints was nearly 800,000. That is the most of any day in this entire pandemic, and up from a low back on April 14th of just 87,000. However, the industry is still far from recovering. That 800,000 number on Sunday was less than a third of what it was August 2nd a year ago. And as the coronavirus surged across the U.S. lately, ticket sales were reportedly down 79% last week versus the same period in 2019.
I would say the two biggest words relating to the industry right now are uncertainty and competence.
Ben Baldanza is the former CEO for Spirit Airlines.
Meaning uncertainty about what the world is going to be going forward as it relates to this virus and demand for the industry, and competence, which is what is needed for the industry to engender in customers to feel safe flying again. So airlines have put in sort of multiple layers of safety things, from what they do in the airport to the way the air flows on the airplane, to the way they're cleaning. About half the airlines are keeping more space in the airplane by blocking seats. Not all airlines are doing that, some are. But the whole game now is try to make customers recognize that they can fly and be safe, or at least as safe in anything else they would go do in this pandemic world right now.
Now, I know that social distancing is very, very hard to do on an airplane. I mean, the whole point, you have to pack as many seats in as you can on an airplane, right, in order to make money in the industry. So when you talked about not having some seats available, like the middle seat, which some airlines are doing, how difficult is it to make any money as an airline when you don't sell those seats?
Well, in the short term, it can work in the following ways. If you think about it in economic terms, the airplanes are already paid for, right? They're not able to not pay for the airplanes right now. The people in the airline industry, at least until the end of September, are being paid through the CARES Act. And that was, a $25 billion grant from the government to keep airline employment up. Basically, had that not happened, a lot of people would have been laid off or furloughed, and they would have gone on unemployment rolls, so the government would have paid that way. By keeping those people employed, it allowed them to stay trained, to stay current in their job, so as capacity could come back, they were there ready to fly those flights. So the people are being paid now, the airplanes are paid for, and fuel prices are pretty cheap. So because of that, those are the three biggest costs an airline has: fuel, labor, and planes, and that they can make positive cash with only maybe 20 or 30 people on the plane.
There have already been talks of tens of thousands of potential furloughs looming if Congress doesn't act, and so far they're having a hard time with any kind of stimulus in Congress at the moment. What happens in October if they don't get any more money?
Airlines have been encouraging early outs or leave without pay for people to voluntarily say, I'll step out for a few more months. Some people might say, I'd rather not be in the airplane right now, and so maybe I'll take a few months off and can deal without the pay. And what they're trying to do is minimize the number of people who would actually have to be furloughed or laid off at that point. But the fact is the industry will needs fewer people today. And if they're not being paid, they will have to let those people go. That's why I think it's so important that Congress, act appropriately to support business. And I think a re-up of the CARES money as it relates to airline employees makes a lot of sense.
Even with nobody sitting in the middle seat next to me, and there's somebody, in the aisle seat maybe a couple feet over, and I got somebody behind me, and I got somebody in front of me, and I'm sitting on a flight for 4 to 6 hours breathing the same air. That's what people think anyway. That's the concern a lot of people have, is they're sitting there for hours and hours breathing the same air. Tell me how airlines fix that. How does an airline scrub the air in a plane?
Well, they've what the airlines have to do is do a better job of fixing that narrative, because the reality is you're not sitting there for 4 to 6 hours breathing the same air. The air in the airplane is recirculated every 3 to 5 minutes with fresh air from the outside. So basically every 5 minutes you're breathing new fresh air because the air is sucked in through the engines, comes in from the top of the airplane and vertically flows down. So imagine if you and I are sitting in a restaurant and we're sitting maybe 20, 30 feet apart and I cough. The airflow in that restaurant, which is horizontal, will essentially deliver my cough droplets to you, right? So that's a somewhat risky situation. If we're sitting on the same plane and I'm sitting in front or behind you and I cough, well, first of all, we'll both be wearing masks if we're on the airplane, if that's required now.
Unless I'm eating or drinking, because you can't wear a mask the entire time, right?
That's right. But secondly, I'll have your seat back in front of me if I'm behind you, right? So I'll cough into that. And the last thing is the airflow in the plane will actually take my droplets and push them down to the floor. It will not carry them forward to you because it's vertical. So airlines, I think, need to do a better job of explaining the way air really moves on the airplane and how it is refreshed regularly throughout the flight. So while you're on that plane for 4 to 6 hours, you're probably safer in terms of getting virus transmission than almost anything else you would do other than just maybe staying at home. I mean,
so in a movie theater, which a lot of people aren't going in, movie theaters, you mentioned restaurants, that's the air in a plane, you're saying, is circulated much more than in a lot of other indoor places we go.
Yeah, office buildings, grocery stores, restaurants, yes, buildings that we still will go to today, but while keeping our physical distance. That's right.
What about cleaning on the airplane? I just saw a story that Southwest is not going to do the seatbelts anymore in between flights. They'll do them, at the end of the day, but in between flights, they won't clean the seatbelts or the armrests, but they will do the tray tables, I guess the bathrooms as well. What does an airline have to do you think, between flights?
I think they should clean as best as they can. I think they should also encourage people to bring their own maybe disinfectant wipe, and you can control the actual space you're in. I've flown 3 times in the last few months, and I brought a wipe on board and just wiped down my armrest and my seat and the little knobs above that you pull the air out, and I just felt better about it. I don't know that I needed to do that. I didn't think they were dirty. I don't know that the airlines hadn't cleaned those same surfaces 15 minutes earlier. But I said I can control where I sit at least and take ownership of that. You may have seen that JetBlue just announced that a partnership with Honeywell, where in the evenings at 2 of their biggest airports, they're going to be using this robot that puts UV light through the whole airplane. It's an interesting thing. We'll see if it works. And basically, the robot will go up and down the aisle, and it'll disinfect all the parts of the airplane. Now, that's not something they can do between every flight, but if the airplane is starting the day fully disinfected, cleaned throughout the day, then disinfected at the end of the day, that hopefully will sort of send the message about the airplane can be a clean place to be for the couple hours you're there.
Flight attendants have a tougher job now because, if someone doesn't want to wear a mask or doesn't have it on the whole time, they have to attempt to sort of be like police in the air a little bit on that, and it's got to be a really difficult task.
I totally agree with you. Flight attendants' jobs are difficult in any environment, but then sort of having to be police on masks is something that they really shouldn't be in that position. The airlines require it. You can't board the plane without the mask. So if someone decides to make their political statement on board and say, I'm not going to wear the mask, I think the right thing for the flight attendants to do is politely ask them to put it on. And if they don't put it on, then go tell the captain. And most airlines today are being more aggressive about banning customers who behave that way. You saw just a week ago or so that Delta Airlines returned a flight to the gate when 2 customers wouldn't put their masks on. The flight attendants told the captain, he said, well, we'll go back to the gate and take those people off. And when there's a consequence to not wearing your mask, such as you won't be able to fly on that airline anymore, or you're not going to even take the trip that you thought you were going to take, then hopefully people will behave.
Do you think any airlines that are flying now will no longer be flying, go out of business because of this?
Well, I think that, You've already seen some airlines in parts of the world file for bankruptcy protection. You've seen a couple go out of business. The last number I saw was that over 900 airplanes around the world that were flying before COVID have now been retired and rejected. So 900 airplanes are not coming back that were there. So you're already starting to see that. I think within the United States, the airlines are generally financially pretty strong from a history of 8 to 10 years of good profitability and generally sound cash management. So I think that airlines in the U.S. are doing the right things around managing their cash, getting good sources of liquidity, flying the amount of capacity that can generate more cash, and reducing costs that aren't needed to spend right now. So unless the demand shortfall lasts, years and years and years longer than people expect, I think the U.S. airlines are probably in shape to not have to file bankruptcy or go out of business. The biggest risk is with the carriers who are very dependent on long-haul travel. That's because I believe long-haul travel has a higher hurdle to recover than short-haul travel, even after you or I may be comfortable saying, okay, I'm willing to fly a 2-hour flight to New York or Dallas or something like that. That doesn't mean that we want to be on a plane for 14 hours, connect in Dubai and fly another 8 hours, right? And so I think the long-haul travel is an issue. I think the governmental rules around quarantines keep changing there. You certainly don't want to fly someplace and then have to stay in a hotel for 14 days, or while you're there, find out that when you come back to the U.S., you're going to have to quarantine for 14 days. So that adds another risk to the long-haul travel. And the airplanes involved in those flights are the most expensive to buy and the most expensive to fly in the industry. So for all those reasons, airlines like a Delta, United, American that fly those kinds of planes for part of their service, or an airline like Emirates or Singapore, where most of their service is like that, are going to have the biggest challenge here.
Ben Baldanza, former CEO for Spirit Airlines, current CEO for DeMacher. Thanks so much for joining us.
Thank you so much for a great conversation.
It's the Perino and Steyerwalt I'll Tell You What podcast. Dana Perino of The Five and Fox News political editor Chris Steyerwalt dissect the ins and outs of national politics. Subscribe and listen now by going to foxnewspodcasts.com.
It's time for your Fox News commentary.
Dr. Nicole Saphier.
What's on your mind?
Nearly 6 months after COVID-19 began to ravage our communities, there remain 3 constants. The threat of the pandemic reigns prevalent. Frontline health responders and other essential workers continue tirelessly, and politicians are finding ways to exploit the crisis to benefit special interest groups. Over the last few months, hundreds of U.S. healthcare workers have already died from COVID-19. Nonetheless, nurses, doctors, and many other medical personnel continue their efforts while acknowledging the risk that accompanies their jobs. Meanwhile, on Capitol Hill, there is a renewed effort to include legislation in any new COVID-19 relief bill that would show politicians sincere appreciation for doctors and other service providers by essentially cutting their pay. Historically, there has been a push by members of Congress to rate set for out-of-network coverage, which effectively punishes doctors in a misguided attempt to solve for what some call surprise medical billing. The goal is laudable, and one that we can all support. Patients should not be the ones stuck in the middle of billing disputes, and no patient should go bankrupt for emergency medical procedures. But the balance occurs when a patient receives a bill for the difference between the cost of the medical service and what their health insurance is willing to pay. So really, it should be called surprise insurance denial rather than surprise medical billing. What we continue to see are insurance companies playing their usual games in order to either squeeze patients or healthcare providers by not covering the cost of services provided. Turning to government rate setting is akin to putting money back in the pockets of the Goliath health insurance companies rather than paying the doctors and other personnel for services rendered. They do this by keeping reimbursement rates so low that doctors and other medical service providers are forced to further consolidate or stop taking insurance altogether. The impact of government rate setting will be felt the most in rural areas of the country where quality medical care is scarce to begin with. Faced with budget constraints, providers will need to cut services, hospitals will cost shift, and even air ambulances, which are particularly critical in rural America, will need to close air bases. Americans cannot be faced with a care shortage crisis right now. If COVID-19 has taught us anything, it is the role that high-quality healthcare plays in keeping this country safe. Too many regions in our country are already feeling the effects of hospital closures in their community from reimbursement cuts. That will only be exacerbated if the medical community is hurt financially because of the surprise insurance denial legislation that's currently being discussed. Meanwhile, there are two groups that benefit greatly by these legislations: health insurers and the politicians who receive the industry's very generous contributions. If the out-of-network legislation goes through, the insurance companies will be popping a cork with their Washington, D.C. allies, as politicians are also beneficiaries when insurance companies profit. While doctors, nurses, hospital staff, and EMTs continue to descend on the hardest hit areas across the U.S., we now see what the health insurance are up to. They dispatch their well-paid army of lobbyists to infiltrate Washington, D.C., and work with their pawns in Congress to concoct a scheme that will inflict direct consequences on our frontline heroes. Congress and the White House should be finding ways to protect our health responders as COVID-19 continues to demand their resources, not empowering health insurers to continue their deceitful and destructive practice of surprise insurance denial. This is Dr. Nicole Saphier. I'm a Fox News contributor and author of the best-selling book, Make America Healthy Again.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. Did you hear the news? Now you can. With instant updates from Fox News for Amazon Alexa. Just say,
Alexa, play news from Fox.
In Fox News.
It's the latest when you need it, on demand.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.